And on behalf of the Chamber, we thank you for coming. I also wanted to thank LaFosse for sponsoring the event and helping organize it.
A lot of things are happening in medicine and healthcare in Brazil. There are new business opportunities, and so much is happening that we thought it would be very important to bring people together for them to understand better what are the opportunities and what is happening. During the COVID pandemic, healthcare systems in Brazil have responded strongly, leading to several new opportunities, including investment in business options, and with the post-pandemic, which I hope we can say that will be the case, there are opportunities which include the development of cutting-edge vaccines, increasing participation of local research centers and laboratories, progress in digital health regulation, expansion of hospital complexes and healthcare infrastructure, and demand for innovative medical products.
I think it's impressive how we were so quickly exposed to telemedicine during the pandemics. From the onset of the pandemic, so in the first week of the pandemics, we already experienced a growth of 800% in the use of telemedicine in Brazil. That means we were so out of a sudden sent home. We were asked to remain in our homes, but of course we still needed healthcare assistance, and the logical means for providing it was through telemedicine. Telemedicine was not something new. We've been using it for a long time, several years, but of course it was underused, I would say. So, and after this initial movement, so what we, that data show today is that we had just in the first, in the years in 2020, 2021, over 7 million remote appointments, and we are actually expecting this to grow steadily in this year. So we are actually expecting more than 30 million remote appointments in this year 2022, and that will be of course a result of these two numbers that are here, which are that 70% of healthcare institutions in Brazil have had some kind of exposure to telemedicine in the past few years, and more than 90% of doctors have somehow approved the use of telemedicine in their daily routine, and they clearly indicate that they will continue to use telemedicine in the post-pandemic world. So that of course leads to a number that it's on the top there, that is an increase, of course, in investment in this area. So we have seen this, an increase of 329% in fundraising in startups and in the healthcare. When there was the need for the use of telemedicine, the regulators, stakeholders in this field, they reacted very quickly to the needs of the market, and already in the beginning of April 2020, we already had one regulation issued by the Ministry of Health regarding telemedicine, and actually a law that had been a law passed in the Congress generally approving the use of telemedicine. So I think that quick reaction helped a lot. It does try to address the need of any in-person appointment. Actually, it said that it would, well, if it's approved as it is today, it will no longer be required, any in-person appointment except if the doctor requires so. And of course, it also addresses the point of medical fees and things like that. It's not, of course, a definitive law. That will still be discussion. Of course, this is natural of this market, but I think that would be the next point of attention for stakeholders that want to be in this field.
The definition of clinical research according to the NIH is all kind of research involving human beings. human beings involved for the development of new drugs, new vaccines, new devices. Thanks to clinical research, we are living much more. We all know how long population is living now, and thanks to clinical research, we are not using masks today. That was a tragedy, a terrible moment for humanity, but we can see at this moment now that much happy to meet you, John, here, to meet all of you. We see here very interesting data is a publication from IQVIA about the global trends in 2022. We saw a fantastic increase of R&D expenditure, achieving 133 billion last year, and with a growth of 2 digits, 44% since 2016. And there are a lot of appetite of venture capitalists, maybe some of them are here in this room. In the last years, we can see a tremendous flow of investment with venture capital, private equities, and this is really in upscale. Here's a map of all clinical trials studies, very recent from July, showing that the number of studies are still much bigger in the North Hemisphere, United States, in Europe, and in Latin America, where we are, in Africa, we still can see a low number of studies. This means that there are a lot of spaces for growth. Here are the numbers of Latin America. Brazil is far the country for more clinical trials, is sponsored by pharmaceutical companies, biotechnology companies, government foundations, and Argentina is in number two with 3,431 trials. Brazil has is a continental country with a lot of space for growth. If one place you have to conduct clinical trials is Brazil. Then number two, we can see here Argentina, and the other countries are also growing, like Colombia, Peru. They are also very aware of the importance of clinical research in terms of new business, good jobs, high-level jobs. And we have a very important point here, that's diversity. Now that's the word very important for clinical research. We have half of our population with Hispanic and African, and just 42.7% of Caucasian, with a lot of opportunity to conduct clinical trials in different diseases, rare diseases, etc. And a multi-ethnic population with a different DNA. That's exactly what you need to develop new drugs, new vaccines for new disease. Used to spend around 112 months to have a new vaccine in the market. In this situation that we just are passing now, we hope that we are in the end, we decrease this for 7 months. According all the accumulation, the knowledge accumulation with genomics and biotechnology, people always came to the doctor and say, how come you have a vaccine in 7 months? This is not going to work. When we saw that was very important, and this jump, is correspondence of the colonization of Mars. You know, it's so important, the speed up of this process. And why it happened next? Because we have all this knowledge in another therapeutic areas like rheumatoid arthritis, thrombosis, oncology. We have at least 65 new drugs for COVID. I'm not saying here about vaccines. I'm saying about new drugs, new antivirals, nasal spray, and many new drugs that we can fight against the virus.
We have an interesting view here of what's happening, not only in Brazil but worldwide. We try to consolidate everything into this graphic here. basically demonstrating that disease care is the concept of healthcare initiating when you go into an ER or when you buy a box of a medicine, and that concept expanding. That concept is expanding towards well care, nutrition, just exercises, genomics, everything related to prevention is really what's taking place in Brazil. Pharma companies that are here today, right? They're starting to look at how can I be more patient-centric? How can I understand the patient better? I'll go beyond that old model of trying to have sales reps and convincing the doctor. I need to understand the patient more and more and enter into this positive cycle here of well care. Health techs are looking at it. They're trying to position themselves in the middle to really orchestrate that process in a variety of ways, beyond among other functions. But this is the view, from birth to death. It's what we see as the two cycles of what we call life care system. It's really a broader view of healthcare. We have researched in numbers as well how much is spent today, last year, 21, in those two, let's say, cycles. Disease care, almost 90% of all the expenditure in healthcare worldwide, with preventive care or well care around 11%. We see in 2030 that the CAGR here, the growth for well care is going to be amazing. It's going to, its share will rise to 20%. So if you can see in numbers, $1.2 trillion, our estimate is it's going to go to 2.8 to 3.5. So the real growth is over here. Disease care will be, of course, it will grow as well. It will lose share, but the real focus is on well care. Again, health techs are really onto it. We'll talk about it when we show you the map of health techs we see in Brazil. I myself have talked to around 45, 50 of them in the last 2 years, really to understand what they're doing, try to find areas of connections where we can interact, and even sometimes go to clients together. Sometimes we end up hiring some of them for our preventive and we call it Be Well, Work Well for our teams at PwC. We bring them on board to help us with our own, health process with our teams. Well, this is another interesting idea. We produce a lot of content in Brazil and worldwide. It's our view of data and how data is going to be fundamental for healthcare looking forward. In Brazil, data in health is extremely fragmented. Okay, so we have the payers with their data, we have hospitals with their data. Like I said, consolidation. The hospitals themselves, these big chains, these big ecosystems, sometimes they don't even own their own data, right? Because they buy so many hospitals everywhere that they haven't really had that opportunity to integrate within their own groups. Imagine outside. So health techs are here as well. They look at this as an opportunity. So many health techs are entering the process improvement area by integrating data. They are working with data specifically. They are, let's say, spearheading discussions in open health, which is something that has been discussed in Brazil in order to get the data really to the patient, to hold integrated data for everyone in a single place. Yeah, that's the total number of M&A recently. So well-being in terms of amount invested was really the big one, the big segment, with 61% of all the funds routed into the well-being space that health techs are looking at. It connects to that view of well care being the focus for the future. And then records and electronic data for patients, all of that also in second with around 10%.
Dovetailing your comment, where is the system in Operation Resilience? Because this is exactly what we're talking about here. Is operation resilience dovetailing with cybersecurity, dovetailing with legacy? Legacy of documents, signatures, which a great use could be possibly blockchain.
We work a lot with cybersecurity as well, especially in the healthcare sector. The two major, and I'll say that because it's public, but the two major cybersecurity breaches or ransomware that happened first with Sírio Libanês, the hospital, 2 years ago, and then Fleury last year. They called us, and we are heavily involved from day one, from moment one, on the remediation of the process, and it's traumatic. I mean, it's a traumatic process. Healthcare data is very targeted by hackers from everywhere, and it's said to be, let's say, 25 times more valuable than a single financial point of data, because it's more complete and it helps them triangulate data about someone in a much complete way. And others are happening. I think Golden Cross was attacked. Apvida.
The first one.
Yeah, back then. So I mean, they're really targeted, and like you said, operational resilience, cybersecurity is not just let's say putting a well-purposed hacker on the good hacker to prevent something or do something on the computer. It's much about process. We have learned that it's usually a pen drive or an employee of the company that is let's say convinced to do something within the company, or sometimes it's a mistake in the process itself within the company that provides those vulnerabilities. And it's a daily exercise. We talk to clients, and our clients that are, let's say, CIOs, CTOs, right, the technology officers, every week they're called by the board and said, hey, this happened again somewhere else. Are we ready, right? Do we have the right processes, etc.? And it touches everyone. It touches the doctor that's inputting information. It touches the whole system, and it's a continuous review of operations. It is all digital nowadays, right? So there's no way around it. It's only getting worse, I believe.
So the first question is, I noticed very interesting those mobile trucks, like ambulances, that are going to go out into faraway places and collect information, clinical data to support clinical trials. So from my understanding, one of the big challenges of clinical trials is not collecting the data, but following up afterwards, like 6 months later, 12 months later, 5 years later, and staying in contact with those patients to collect the information. So going out, is great. How is that going to be approached by your organization to somehow manage to stay in contact?
Clinical research is a situation with strict control, following a protocol that could come from a sponsor like Pfizer, Novartis, Eli Lilly, or a foundation. But this strict control, it depends on the protocol. Generally, a protocol is more or less 6 months protocol, or 2 years, or 3, 4. Then we state the time according to the protocol. When finished the protocol, the patients and the situation go back to the system, the health system. Okay, there is some confusion about clinical research and medical assistance. We do medical assistance during the protocol. After that, that's a government problem. Then the company can go there, conduct the trial. When finished the trial, we can give some medical assistance and refer patients to other service, but we are not responsible anymore forever for these patients. Okay, that's a very important point. That's a big discussion in Brazil where our CONAP, that's the central IRB, they think that we are going to be responsible for the patient forever. This is not feasible.
This is just to move into another area. There's so much presence of technology, more and more. And I was curious to know, what will the role be of artificial intelligence in moving in and almost even taking over a lot of the things, and what would the impacts be? One example is genetic modification. I mean, where is this going with this huge movement of artificial intelligence and technology sort of taking over so many things?
AI, just taking a step back and then I'll talk about more futuristic, but AI is not as, it's not like that movie, right, with a robot and stuff. AI can also be something more something simpler. And this is already happening actually. When you look at, for example, the startups developing algorithms and new processes and etc., they are applying AI in a way. One example is of a startup. One of the greatest challenges in hospitals is to have doctors input the right information into the system. They like that piece of paper, they write it up and share. But for the hospital itself, it's really good to accumulate standardized data in a certain way and input it into the system. But doctors, they don't like that process. They avoid they think it's overwork. And one thing that's been developed by one startup is a system where it learns on how that specific group of doctors in a specific hospital, what do they prescribe, what do they do in a specific process or event, and they have a system that learns with that history and suggests, for example, it suggests, hey, in this case, 90% of the times, this was the recommended procedure. Do you agree with that? So it's like AI in a way, as machine learning, for example, is already happening in a simpler way. Now, when you look at AI, for example, that very futuristic model of autonomous cars everywhere. I mean, how does that apply to healthcare? I mean, it's difficult to say now, but there are many developments in new drugs, CRISPR in the West Coast. I mean, with Jennifer Doudna, right, and other, even here in Boston as well. I mean, there are many developments in that area, in genetics, where AI is also going to play a role somehow. But again, there are two AIs, I would say. There's the AI of the day-to-day, of operations, of learning processes and making them quicker, and making certain processes faster. That's already happening. And there is an AI which is more autonomous, more which is a risk. I mean, you don't want a computer taking over the decision making of a doctor, right? The decision is always in the doctor, in his her experience, subjectivity, physical analysis of the patient right there. I mean, so I don't think AI is going to take out that function just yet.
Right, thank you. That was really excellent. Thank you very much. And I hope we can do this again soon. Anyway, thank you all. It was really, really excellent. Thank you again. And thank you, James, for helping putting this together. And
Thank you for our faculty. Thanks, John. Thanks, Jim. See you next year.